to the SHIP Evaluation Learning Collaborative. This is session 2, and we are going to move full steam ahead. We have a few people on the call today, so I'm going to have you guys introduce yourselves. Just quickly, just remind everybody your name and what state you're from. So Martina, do you want to go first?
I'm the flagship coordinator from New Mexico.
Great, welcome. And Lisa? Lisa, I think you're out there. This is also a good check on if everybody's able to communicate. Is that Lisa?
All right, okay, I believe I'm unmuted now. I am Lisa Garza, and I am from Kentucky.
Great, welcome, Lisa. Yeah, it's star 2, and sometimes it's hard to tell if it actually worked or not. Joyce, do you want to introduce yourself?
Yes, this is Joyce Thornworth, Indiana.
Welcome, Joyce. And how about Kate?
Hey, this is Kate Harmon from Alaska.
Welcome, Kate. And let's see, who else do we have on here? Angie, do you want to introduce yourself? We can go to Sherry. Sherry, you want to introduce yourself?
Hey, this is Sherry Wyatt from Texas.
Great, welcome today. And Angie, are you on? You want to introduce yourself?
It looks like Angie hasn't dialed in quite yet, but she's working on that.
Okay, great. All right, so Angie will be joining us as well. All right, so we may have other people join us, but we are going to get started. As everybody knows, this is Rochelle Spinarski. I'm from Rural Health Solutions, and this is session 2 of our Learning Collaborative. And today's agenda, we're just going to have a couple of reminders about our topics from session 1, and then we're going to move right into creating SMART objectives. SMART objectives are a critical part of creating an evaluation and an evaluation plan. So we're actually going to spend the majority of our time there, mainly making sure that everybody understands that, how to create them, what the connections are to creating an evaluation. Then we're going to create some measures that are specific to those objectives, and then we're going to just kind of talk about creating an evaluation plan, etc., and then move on to some homework and next steps. So we do have a busy agenda. I think that everybody remembers that this session is an hour and a half. We really ran out of time during our last session, so we've extended it just so that we can get through everything. We may have a little extra time on the back end, but really wanted to make sure we have enough time to talk and walk through everything for everyone. So here's a list of our Learning Collaborative participants. It's great if you want to connect with one another as you're working on initiatives. Hopefully you'll learn from one another through this process as well. So keep everybody's names in your back pocket so that you can connect and reach out to one another. Here are all of our states that we're working with as a part of the collaborative. Everybody, after our last session, everybody was asked to kind of choose an area of focus, the goal that you're going to focus on as a part of the Learning Collaborative. And so we're going to, the materials that you see today are going to feature some of the goals that you selected. And then in addition, the toolkit that was created also has some examples that tie directly back to some of the goals that you want to focus on as well. So we're going to be talking about different goals as a part of this today, tapping into the areas that you want to focus on as a part of this Learning Collaborative. But one of the things to keep in mind is everything that we're learning does apply to all of the goals. It's just really kind of using the methods and the philosophy as you're creating your evaluation plan for your entire program. So it should, everything should apply across all of your goals, but we're really, in order for you to create a plan specific to a goal, we're going to be focusing on some state-specific goals that you've selected. Another thing, just as a reminder from the last webinar, that the goal of your SHIP evaluation as a whole is to make decisions and or answer questions about your SHIP. So that theme is going to be resurfacing today as we talk about the objectives, as we talk about measures, as we talk about process. So this whole process is about being able to make decisions and answer questions about your SHIP. So it's a really important piece as you kind of put your evaluation hats on and you think about your SHIP program and some of the questions and answers that you want to be able to answer as a part of your program as a whole. A few highlights from the first Learning Collaborative. We talked about I gave an overview of what the Learning Collaborative process is going to look like. We did some introductions. Everybody learned a little bit about each of the states and where folks are focusing on in terms of SHIP programs. We talked about some project focus areas by each of you. And then we talked a little bit about stakeholder involvement in program evaluation, how that can be used, why it's important, how you can leverage that as a part of your program and making improvements, etc. And then as a part of homework, everybody was asked to identify this Learning Collaborative focus area that you're going to use in this process. We talked about priorities, and like I said, everybody's choosing one, and we're going to now walk through some parts of that as a part of thinking about objectives and measures. We also talked about key questions that you should be thinking about as a part of your evaluation. These key questions are in the toolkit. If you want to refer back to those as you're thinking about evaluation priorities, if you're thinking about the questions you want to answer as a part of your evaluation, you can always refer back to the toolkit in order to see some of these questions and to be thinking about the questions that you have about your program as a whole. All right, so during the last Learning Collaborative session, we talked a lot about goals and setting those goals and stakeholder input. Today we're moving down into this next section of the process of evaluation. So as I noted, we're going to move into the second curve, which is working on objectives. And then after we create our objectives, we're going to move on to creating measures. So the whole process of the Learning Collaborative is basically working through this whole system of goals, objectives, measures, collecting data, using measures, and then showing impact. So we're moving on to now the next step in this process. Okay, creating objectives. One of the things that I did as a part of all of your attachment 5s that you submitted for your evaluations and your SHIPs was to look at the objectives. What objectives has everybody created? What are the objectives that you're working from at this point in time? And what's everybody thinking in terms of creating objectives as a part of your SHIP program? So we are going to really focus a lot on these objectives because as I look through the objectives, I think this is definitely a place where if you get off on the creation of your objectives, it really leads your evaluation in a totally different direction. So if we create clear-cut measurable targets as a part of our objectives, you're going to be in a much better position to actually create your evaluation and your evaluation plan. I would argue that creating objectives is the most important part of creating your evaluation because you're going to be relying on these objectives for all of the steps that you build into your evaluation plan, and it's the piece that you're going to go back to when you ask your questions, when you're answering your questions as a part of, did you have an impact, what are you trying to have an impact on, etc. So creating objectives for me is the big first step of creating my evaluation plan. You've probably heard many times that objectives need to be SMART. And I think this can be a challenge for folks just because coming up with well-defined objectives and having something that's quantifiable can be a challenge. Sometimes it doesn't seem like something can be quantifiable. But as we walk through a whole series of objectives and talk about objectives that you're working on, but just have defined in a different way, we'll be able to kind of experience all the different ways that we can define objectives to come up with SMART objectives. So first of all, an objective should describe what activities or interventions must be achieved in order to reach our stated goals. So these are kind of the milestones, the things that you are trying to achieve in order to get to that higher goal that has already been prescribed to you as a part of the SHIP program. As I said, they should be SMART, which is specific, measurable, achievable, realistic, and time-sensitive. So the time-sensitive piece is it's by a certain date. It could be by project end. It could be by the end of year one. It could be by a specific date that you've predetermined based on your program. Attainable. Attainable is really important. Sometimes when we create SMART objectives, I'll look and see, and the objective is too lofty. It's not an objective that's even achievable. And oftentimes when we create our objectives, we're going to be basing it on baseline data or on historical data, data that you have seen in terms of other states, data that you've seen in terms of some of the CHs that you've worked with or hospitals that you've worked with, in order to know what is actually attainable. The other piece is that it needs to be measurable. It should be quantifiable, 25%, a national average, some type of benchmark that you're going after. If we're talking about days in accounts receivable on the financial side, it could be 55 days. If it's talking about a certain amount of days cash on hand, it could be 100 days cash on hand. It's a measurable, quantifiable amount that you're actually aiming to achieve. And then from SMART, the specific part is that it is really well-defined and focused. The more well-defined and focused it is, the more able you are to create measures that can actually determine whether you achieved your objective or you did not. The other thing to keep in mind too that I think can sometimes get really confusing for folks is that you may have one goal that has multiple objectives. So don't think that you need to have just one goal with one objective, because oftentimes you're trying to accomplish several things within that one goal as a part of your program. So it's very helpful to break those different objectives apart so that you know exactly what you're trying to achieve in order to get to that goal. The other thing is if you're doing a program over multiple years, you may have objectives that actually build on one another. So I'm going to show you this as a part of the materials today so that it makes a little bit more sense. But having SMART objectives, not just objectives, but SMART objectives, is going to set the foundation for the work that you're going to put into your evaluation. So as a part of the slides here, you can see that I do have a few SMART objectives that are just some examples. So for example, 25% of rural hospitals implemented the Lean Initiative by September 1, 2020. That's a SMART objective. 100% of rural hospitals report Hcaps data to CMS by January 1, 2021. And then a third one is 100% of rural hospitals receiving a grant to implement care coordination have a care coordinator hired, trained, and operating as one FTE by January 1, 2021. So these are all different examples of SMART objectives that would fit into a potential SHIP program if you were working on any one of these areas as a part of your program. All right, so now we're going to kind of dig into objectives a little bit further. And like I said, we are going to spend some serious time on objectives because this is the one place where I noticed that objectives aren't SMART. So if you look on the left-hand side, these are just examples from some of the evaluation plans that I got in terms of objectives that are not SMART. So for example, conduct effective SHIP program administration. So if you look at that, objective, can anybody pipe in and tell me what about that objective is not SMART? Or what's missing in order to make that objective SMART? Kate, I'm going to pick on you. What's missing in terms of that objective not being SMART?
It's missing a time frame. It's not really measurable and not specific enough.
Perfect, exactly.
I think you can say it's probably missing every part.
Okay, awesome, great. Exactly, it's pretty much missing everything. So perfect, exactly. Let's go to the next one. Assure SHIP hospital compliance with the purpose of the SHIP program. Joyce, you want to take that one?
I think it doesn't say like what part of the compliance. What are you speaking of? It's not identifying what policy and so forth that they're trying to, I guess, address. And the same thing, I mean, it doesn't have how that's going to be measured or time frames or anything like that.
Exactly. Exactly. Again, it's another objective that it may be an objective, but it's not a SMART objective. And the one thing that's really critical about creating an evaluation and a plan as a whole with measures, et cetera, is that those objectives are SMART, because that's what's going to give you those targets that are going to directly align with your ability to create measures. All right, let's go to the next one in terms of the ICD-10 one. How about Lisa? What about the ICD-10?
Well, it doesn't say how many trainings or when a timeline on when they would be completed by.
Okay, exactly. Again, it's missing many of the elements, and in fact, that SHIP objective is, that's more of an activity, what you're going to do with the hospitals, not what you are aiming to accomplish by doing the training itself. That's another thing that I noticed in a number of the objectives is that a number of them are they're written more like activities, so what you're going to do as an office to support facilities, not what are you aiming to accomplish from a quantifiable standpoint as a part of your program. Let's go over to the SMART objective. This one says within 2 weeks of receiving the notice of grant award, the State Office of Rural Health will distribute the NGN contracts to, they were missing the number of recipients, but it says 2 hospitals. So in essence, this one does hit almost all of the buckets of a SMART objective. It's really helpful to indicate, you know, is it all of the hospitals? Is it a percentage of the hospitals? Keeping in mind that even if the person who's created this knows what they're talking about when they've written this objective. Other people may not know it, or if somebody else has to take over this particular responsibility of evaluating the program and they get this objective, they won't know exactly what that person had intended. Had they intended all the hospitals, had they intended just a percentage of the hospitals, etc. So having that, a specific and measurable SMART objective is really, really important.
Rochelle, can I ask a question here?
You bet.
See, to me that almost is described as an activity, though, because to me it doesn't say what the objective is as far as performing that task. It seems like it's more of a task than an objective.
Well, the key with this is that they're going to be able to do something. They can define it, that they, within a specific period of time, they're going to be doing something, and they'll be distributing the grant award or the contracts to the hospitals. So what they're going to be measuring is, do they do it within the 2 weeks? And does it go out, we're going to assume to all the hospitals, does it go out to all those hospitals? So what their objective is their objective is about being able to do this within a certain time period. And one of the things that I noticed, and in talking to some of you kind of in between the last call and this call, is a number of you are trying to improve your process. I think there's some challenges out there with folks trying to get your grants out the door. That, you know, sometimes there's this long lag between getting the notice of award and getting funding out the door. And so this particular objective is targeting that process that they're trying to, this particular grantee is trying to improve that process and decrease the amount of time that it takes to get out the door. Does that make sense?
Yes,
Okay. So we're going to look at a few of these. I have some examples that are a little bit, you know, I'm going to call it, say, smarter. But you know, this was one of the closer SMART, the more SMART objectives that was in the examples that were sent. All right. So just if from an activity standpoint, if you guys want to pull up your attachment 5 and kind of have that on your screen somewhere so that you can toggle back and forth to it. Everybody has a different attachment 5. I'm not going to move through everybody's attachments because there's a lag when I do that, and so you'll have a bigger lag in terms of being able to see it on my screen. But pull up your attachment 5 and then and just kind of browse through that, and I mean your attachment 5 from your application, and just look and see kind of what you're working on from an evaluation standpoint, and browse through it and look through your objectives and kind of eyeball it and see, are your objectives SMART? Do you have any on your current evaluation plan that appear to be SMART based on what we just talked about in terms of being specific, measurable, attainable, and time sensitive? Okay, so everybody's going to kind of just eyeball your own here for a second. Has everybody been able to pull up your own work plan?
yes, I have.
Okay, great. Looks like everybody has. So let's just kind of go around. Let's just go around the table, and we'll start with Angie. Since you're at the top of my list here of participants, let's just go around the table and we're going to run down the list of look and see if there's any objectives on your work plan that you think are SMART.
Hi, this is Angie. I'm with the SHIRT TA team, so I don't have a work plan.
Oh, I'm sorry, Angie. I'm like...
That's okay. I should have identified myself better.
Yeah, that's okay. Kate, do you want to go?
Yeah, so looking through attachment 5, it doesn't look like any of our objectives were really written in a smart way. They kind of read more like overarching goals instead of objectives.
Okay, great. Okay, so and I think so when we walk through a whole kind of list of objectives, I'm hoping that then you will see some that actually apply to your program, and this is for everybody. Joyce, do you see any on yours by chance that you think are smart that you want to share?
Sure. How we did was that we had an overall purpose of each of our programs, then with the objectives that support that purpose. So one of our programs is Patient and Family Experience Community Forum, and the purpose is to improve the Hcaps scores with a goal to provide an optimal patient-family experience always. And then our 3 objectives for that purpose is to, 1, assess the current state of Hcaps scores and process for collecting them, support the hospital staff in their efforts to improve Hcaps scores through training, education, and tools, and then 3, to provide patient and family feedback to the participating hospitals in an effort to identify best practices and opportunities for improvement. Then we just have activities below each of these objectives and how we're going to measure the progress, what the outcome is, and what our deliverable will be. That's how we set ours up.
Okay, so if you look at those objectives that are up above and you go back, so I think you had 3 of them that were on there, and yours are perfect examples because the samples that I'm gonna pull up in a minute are really, there's a big section on Hcaps. But if you look at those objectives, are they specific? Are they measurable? So do you have a target that's in there in terms of something that's quantifiable?
We do.
Are they attainable?
Yes, go ahead, I'm sorry.
No, go ahead.
Yes, so for example, for objective 1, where we're going to assess the current state of the Hcaps scores and the process for collecting them, what we're going to do is conduct hospital-specific assessments of the Hcaps process and current results. We're going to do that between August 1st and November 30th. We'll measure it by the number of assessments completed, and then we'll determine the outcome or the impact by identifying the hospital gaps and areas of improvement, and then we'll evaluate it based upon assessment reports. So that's what we would do for objective 1.
Okay. So, and what we're going to do and what we'll see kind of through this process, because I think what Joyce has just described, it's a pretty common structure that I think many, and this isn't unique to you guys, I think this is, kind of across the board, that many of the objectives are structured in this same way. And so what we want to do is we want to kind of flip that over so that your objective, which I think the first one was assess the current state, that we change that language so that that it is something that's quantifiable, so that you know whether you've assessed it or not. So for example, 100% of critical access hospitals' current state was identified by such and such a date. That's the type of thing that we're going to be aiming towards as we create these SMART objectives for each one of your objectives. And Joyce had a perfect example where she had a goal and she had a number of objectives that were listed underneath that. So we just want to tweak those objectives so each one of those are SMART. Let's do one more example. Let's see, Martina, do you want to look at yours? Did you have any on yours that you thought were maybe SMART objectives?
Well, we have an objective 1 and which is within 2 weeks of receiving the notice of grant award. The State Office of Rural Health will distribute the NGA and contract to hospitals. And then it's divided into activity, evaluation, and target.
Okay, and that was kind of the similar objective to what I highlighted earlier when I was doing this. In fact, that might even been one of the smarter objectives that came directly from your application. All right, exactly. So that's more of what we're looking for as a part of creating objectives. We're going to now go and I'm going to pull up, I'm going to ask all of you guys to go to the SHIP sample. In the file share, there's a SHIP eval sample that's objectives. Can you guys open that particular document? It's going to look something like what's in front of you right now. And just let me know, give me a heads up when you've got that that you've got it open. Looks like Kate has it open. Sherry's got it open. Rachel has it open. Joyce has it open. All right, looks like everybody's getting really close. Okay, so now that you have that document open, what I've created for you, and I'm actually going to go over to my, what you see in front of you just on this whiteboard is kind of a sample of a part of it. I didn't paste the whole document into this because I think it'll be easier for you to look at it right in the Word doc and we can walk through it together. So I have a just a smorgasbord of objectives that I've outlined for some of your programs. And as I said earlier, I know a number of you are working on the program administration side of your program, so really trying to make it more efficient, bring more of your rural hospitals on board as part of being SHIP grantees, improving just the process as a whole of distributing funds, etc. Also, some of you have created some online application tools that you're trying to determine whether they're working and not working, etc. Then another area that we're going to, that I've featured because a number of you are working on Hcaps is another sample that's just focused on Hcaps. So first of all, in terms of thinking about objectives, I have the first sample, which is again focused on program administration, and one of the objectives, and this was a common objective in a number of the evaluation plans that maybe was spelled out a little bit different, but you know, this same kind of theme for an objective, which was conduct an effective SHIP program administration, or to conduct an effective SHIP program. This kind of an objective isn't a SMART objective. So in order to get this objective into a SMART objective, this is where we kind of swing our minds back and think about, what do you want to answer in terms of your program? What are you thinking about? If you're trying to make your program more efficient, if you're trying to make it more effective, what are the things that you're trying to improve? So are you trying to improve the efficiency of the SHIP process? Are you trying to improve the SHIP process? It may be based on past experience. I know some of our grantees are, like I said, are having a tough time administering the funds, and so you're trying to just improve that process, improve the satisfaction of your SHIP grantees. Are you trying to improve the onboarding process, so educating your SHIP grantees about the SHIP or the SHIP eligible hospitals, about the SHIP program, what's available, who can access the funds? If you're one of the programs that's created an online application tool, are you looking at what's the satisfaction with its use? Are you trying to determine the response rate by hospital of who's using it, the timeliness of completion? What are you trying to evaluate in terms of this administration process? And you may have a whole list of objectives that you're trying to target, but you may also just have a couple of areas that you're trying to target because those are your challenges as a program. You can, once you know what those questions are that you're trying to answer, that's what you're going to build your objectives around, is whatever you're trying to answer as a part of that program. So I'm going to, we have another sample for Hcaps, but I'm going to ask you just to scroll down and go to the to page 2 at the very top, and it says Smart SHIP Objectives. And on that page 2, it says Conduct Effective SHIP Program Administration. Once again, that same sample is carried over now to this page. So thinking about, what you're trying to answer, if it's efficiency in process or satisfaction, what I've laid out here are a number of objectives that could apply to any one of these questions depending on what you're trying to tackle as a part of your program. So instead of conducting effective SHIP program, objective 1 would be in year 1, 100% of SHIP grantees receive funding within 21 days after State Office of Rural Health funding receipt. Straightforward, how many days, something that's smart, so it's specific, it's measurable, it's time sensitive. You want to know exactly what you're trying to accomplish as a part of this particular objective. Another objective, 85% of SHIP eligible hospitals seek and obtain funding in year 1. So for example, if one of your challenges is that you have a lot of hospitals that are eligible for SHIP funding, but you are having a lot of hospitals that are opting out of SHIP, this may be an objective that you've selected. 85% may be on the low side. You'd have to determine what that percentage is based on what your experience is, but it gives you a target. You're going to be targeting 85% of 85% is your goal. If you're already sitting at 85% and you're historic, or you're sitting at above 85%, but you're really aiming for 100%, you would say instead 100% of SHIP eligible hospitals seek and obtain funding in year 1. Then if you had that lower number and you were going after 85% in year 1, you may decide in year 2 that if you get to the 85%, now you're going to be having your objective as 95% of SHIP eligible hospitals seek and obtain funding in year 2. So this is just an example of if you're going after this particular issue or that's your challenge, that may be an objective that you use. I have another objective on here that says all SHIP grantees indicated the funding options made available met their whatever those needs are during year 1. So let's say that you started a new network and you wanted to, you're trying to figure out whether that network or whether that new group, that new level and area of funding that you were trying to tackle, whether that actually met their needs. You could use an objective similar to this. Is that making sense to everybody?
I have a question, if that's okay. So, and I'm new, so I started in July, so all this was kind of done before I started. Is this information then to be used to be submitted for the next grant year since we've already submitted our work plan for this year? or is it that we're kind of internally supposed to go back and readjust our objectives so we can report better outcomes because our objectives have already been submitted through the work plan? Does that make sense?
That does make sense. Now, so you have a couple, I think you have a couple of options, and I don't know if Sally or somebody else is on the line in terms of timing for things. But I think that this particular learning collaborative, well, two things to think of, but I'll let one of the program staff pipe in here. But one, at any point in time, you can always go back and change your objectives and use those moving forward, especially if you're wanting to tweak a program area, or you know that you have a challenge in a particular program area. The other thing that I'll note is that for sure consider this as an opportunity for when you're submitting your next application, because whatever you submitted in year one doesn't mean that you can't, when you submit your next evaluation plan, that it can't be a complete adjustment that ties better to the goals and objectives that you're really trying to achieve. So I don't know if there's any program staff on, but does anybody from the program staff standpoint want to chime in at all?
Yeah. Hi, Rochelle. This is Sally. And Soleil Berry, our program coordinators on the webinar, I'm not sure she's on audio, so she just typed, she thought it should be for both, applicable to both. And I agree. I think the, what you're learning in terms of the evaluation work plan, certainly, setting new measures is appropriate, or, different goals or ways to capture, since we're, only not quite 6 months into this program year for SHIP. However, if you're, if you kind of look at this and you're like, whoa, we want to really change our whole work plan, which maybe you have more capacity to do that based on your pooling funds through a consortium or a state project, as long as it's, still fitting the categories your hospital's applied for. But if you're looking at changing up the work plan, that you should talk with your F4HP, project officer, Soleil or Janine, or certainly if it changes the budget. But for the evaluation plan, yes, we're encouraging you to begin utilizing some of these steps and tracking or methods of assessment to implement performance management this year, as well as when you start writing for the submission next month for next year's plan.
Absolutely, and this is Soleil, and I echo that, and thank you, Sally, so much for saying that. Really, I love that question's brought up, because it tells me that you guys are thinking about this and strengthening your program. And Rome wasn't built in a day, so looking at what you have right now, the NCCs are a great time to, if you're looking to kind of make them a little bit stronger, to implement this, because part of the NCCs is looking at your work plan, in year one and also for the next year. So bite-sizable is very much recommended, but if you have the capacity to really overhaul this because you're seeing that it's not making sense, or there are ways that you can strengthen this is the opportunity to do so. As again, as long as it keeps the spirit to it keeps to the spirit of SHIP. And again, because evaluation is all on our minds, this is something that we can all be able to kind of jump in and help you with as you're going through.
Great, thank you so much. So the answer then is yes. It's a great opportunity. I would chime in one more little bit, is that the more that you can, if you do have the capacity, because I think that's obviously a key piece to this, but if you do have the capacity, now is also a good time to practice some of this, so that as you as you move forward, the more that you do evaluation, it's like everything. The more it just, you know, it's easier to do it, and it seems it's just kind of a regular part of what you do. So the sooner that you can jump into it, the better off you're going to be in terms of being able to actually practice some of this work. Does that answer your question, Joyce? I think it was Joyce who asked that.
Yes, it does. I just wasn't sure because, like I said, in my example, it appeared it was there, but it needs some tweaking, so I just wasn't sure, you know, if that's just something I utilize in the next work plan or, you know, what I was supposed to do with it. So thank you.
Yep. Yeah, and with any of these objectives that get reworked, it's not looking to change any of your activities. It's really changing the way you're looking at the work that you're doing and measuring outputs, outcomes, processes, things like that. So that's the beauty of creating SMART objectives, is it really creates that foundation so that your measurement is in alignment with what you're trying to accomplish.
Okay, thank you.
You bet. All right, so I'm going to go back to the SMART SHIP objectives Word doc that you have in front of you. And if you scroll down to number 3, again, here, it's another example of that we talked about earlier. So I know one of our projects has created an online tool. And your objective is going to then apply, like I said, whether you're looking at satisfaction with use, whether you're trying to determine the response rate by hospital, timeliness of completion, et cetera, et cetera. So just, again, a series of different objectives. These are just sample objectives that may apply to an online application tool. So in year 1, 75% of SHIP grantees use the online SHIP application tool after initial and reminder emails are sent. An objective may be in year 1, 100% of SHIP grantees report project baseline data in the SHIP application tool. In year 1, 100% of SHIP grantees use the online application tool after initial 2 reminder emails sent along with an online telephone follow-up call. Now, one of the things that I wanted to note in terms of creating these objectives is that it's really important. If you notice that that first objective sample and the third objective sample, they're basically the same thing, except the third one is includes more opportunity for follow-up versus the first one. And so this, you know, depending on what you're including in your objective, really, again, goes back to what question you're trying to answer. And sometimes you may want to break an objective apart if you have some specific things that you're looking at. So, for example, if you're really aiming at only having, you know, 1 email that goes out and an introduction email and 1 reminder with extensive follow-up, then you might want to have that be one of your objectives so that you're tracking that specifically if that's what you're trying to get to from an administration standpoint. If you're trying to, if that's not as important, your objective might be a little bit broader. So some of our programs are really fine-tuning their operations, and other programs are kind of more at the beginning of improving operations. And so the way you've defined your objectives might be a little bit broader. So just keep that in mind as you're creating any of the objectives from your program kind of management standpoint for those of you that are working on that angle of your program. And if you kind of scroll down here, you're going to see other examples. And I tried to include just a whole bunch of examples for everybody so that you could refer to these, because I think some of these might refer to some of the objectives that you're aiming at as a part of your program. with the exception of the fact that, the dates are probably off, and even the percentages or the numbers that I'm talking about may also be off. The other thing I'd like to point out in terms of creating these objectives is the difference between including a number that you're aiming towards or a percent that you're aiming towards. And while it may not seem to make that big of a difference, as I've been doing evaluations for flex programs in particular, one of the things that I've seen in terms of those numbers is in states where the number of participating hospitals is much smaller, I find it more helpful to actually include a number that I'm aiming towards versus a percent that I'm aiming towards. Because I'm talking about much smaller numbers, and as we all know, the smaller the number, the more our margin for error can be a lot smaller, and those percentages can seem like it's a big swing from just having one hospital versus 3 hospitals. So think about that as when you're trying to create your objectives of whether it makes more sense to have an actual number or whether it makes more sense to have a percent. In some instances, your objectives may be both. It may be that you're going after a number and you may be going after a percent. It really depends on what you're trying to accomplish as a part of that particular goal and what you're trying to achieve and what you're trying to answer. So before we go to Hcaps, does anybody have any kind of comments or questions about those kind of process examples that I put out there for everybody? I want to make sure that that objective piece makes a lot of sense to you, just because I know a number of you that is your goal, your area that you're going to be targeting as a part of the evaluation plan that we put together for this learning collaborative. All right, so it looks like we have none. Everybody seems good with that. All right, so let's go to the Hcaps example. That's another place where a lot of you are also working. So that if you go to page 1 and you scroll down to sample 2, I just have it labeled Hcaps. And their goals were kind of all over the board with Hcaps, but I would say in most instances, the objectives that I saw in work plans were about supporting staff in an effort to improve HCAP scores through training, education, etc. So I have, let's see, I think what I have in front of you, that sample 2, there's 4 sample objectives there that you should see. None of those sample HCAPS objectives are SMART objectives. They're not measurable, they're not specific, they're not time sensitive. So our aim will be to shift all of these into being SMART. Now again, similar to when we were talking about kind of the process improvements related to program management above, again, if you're working on HCAPS, there's, be thinking about, what is it that you're trying to accomplish from an evaluation standpoint. If you're creating dashboards, is your question about are folks using them, and if they're using them, is that contributing to improved HCAP scores? Is it that you're trying to increase HCAP survey response rates? Are you trying to, do you still have hospitals that aren't reporting HCAPs, and so you're trying to increase that number of hospitals that are, you've got activities in place to increase reporting? Are you targeting one particular measure or a group of measures within the HCAP? Or are you trying to achieve a specific benchmark? Is it by hospital? Is it across the state? Is it based on a national benchmark, et cetera? So the question is, what are you trying to accomplish as a part of your HCAP initiative? It could be training related. Important too is this be realistic part, because one thing we note is it can be challenging to move the needle on improving scores across the state when we're talking about averages. So really look at some historical data, baseline data when you're thinking about moving the needle on your HCAP scores, so that whatever you're selecting, whatever you're creating, it can be based on trends and it can be based on something that's actually quantifiable. So again, let's scroll down now. You're going to go to page 3. I have sample 2 HCAPS improvement examples. And just like we did for the process improvement examples above, I have a number of objectives, just sample objectives. Again, they may or may not apply to your particular program and what you're trying to do, but hopefully examples that you can tweak or use as a guide as you're thinking about your HCAPS improvement. So for example, in year 1, 85% of SHIP hospitals receiving HCAPS dashboard reports report using them for HCAPS improvement. In year 1, 100% of SHIP hospitals participate in at least 2 of 4 HCAPS improvement webinars during the grant year. At year 1 end, 100% of SHIP hospitals that participated in HCAPS improvement webinars report using HCAPS improvement strategies to improve patient satisfaction. The next example, in year 2, all SHIP HCAPS improvement grantees received hospital-specific HCAP dashboards by February 2020 and August 2020. In fourth quarter 2021, average state top box scores for SHIP hospitals receiving HCAPS dashboard reports are at or above the national average for 5 or more domains. Again, just a series of examples that kind of cut across many of the activities that you're working on related to HCAPS participation and HCAPS performance. Then if you go down to number 3, because I know some of you are working on improving survey response rates, in fourth quarter 2020, all SHIP HCAPS participating hospitals have a survey response rate of 35% or greater. Or in first quarter 2020, all SHIP grantees are reporting HCAPS to Hospital Compare. So just some examples, again, specifically related to HCAPS. Any questions about the Hcaps examples and creating objectives that are SMART? And the key with these objectives that there is SMART objectives, because as we move on to the measures piece next, you're going to see why the tie back to being SMART is so important. Any questions about those? Anybody have any concerns about creating SMART objectives? All right, I don't hear any concerns. So I think our next thing, just to verify, because I want to make sure that that everybody is kind of on the same page, and I can do some additional follow-up with folks that feel like, oh gosh, this objective thing isn't making sense, because the objectives piece is super duper important. Will you put up the poll for me so that we can just make sure that everybody has that? Thank you. So first question on the poll is, do you think you understand SMART objectives so you can create them for the SHIP Learning Collaborative goal you selected? And then the second one is just to verify that you think you can do it for all of your SHIP goals. So for one of the things to note, because we're going to do some one-on-ones together, is if there's a goal, so we're going to be working specifically, and if we have time we can work on more than your one goal, but we're going to be working on one specific goal so that you have kind of a completed evaluation plan for that goal. But if you have another goal where you're struggling with creating objectives for that particular goal, just make sure we talk about that when we meet one-on-one. I'm not afraid to talk about anything related to any of the goals or objectives. All right, great. It looks like everybody's pretty confident. We've got one person who's needs a little bit more support on, maybe there's one specific SHIP goal that seems a little bit more challenging. And I know that some of the activities can be quite challenging, so that definitely makes sense to me. All right, is everybody, I'm going to just do a check-in. Is everybody to move on, ready to move on and talk about measures? All right, perfect. All right, so we're going to go back to the slide presentation. I'm not sure if I can do that. Can I? Great, thank you. And I just have to do a shout out to Kiona. Thank you so much, Kiona. You're really super helpful. All right, so we've done the SMART objectives, and you have access now to that SMART objectives sample set that I sent to you. And then remember, there's also some ICD-10 and value-based purchasing and ACO examples that are in the toolkit. So you'll want to look at those too if you're looking for some other examples. Okay, so before we move on to measures, one of the first assignments, something that I want you to think about, because we're going to look at this when we meet one-on-one, is to think about where you want to store, update, where you're going to be keeping your SMART objectives and building on those. So I just have kind of an outline in front of you, an evaluation plan, kind of the startings of that for, in this instance, the examples are for value-based purchasing investment. But think about how you're going to, how you're going to design your evaluation plans. There's all different ways that you can do it. I think the key is that it's in a structure that works for you. I happen to prefer to use Excel, and then you can save it within some of your other documents that your Excel documents that you're already creating as a part of SHIP, so your other spreadsheets, so that you have everything in one place and it's easy to kind of toggle back and forth between each of the worksheets. It's your call. I know some people prefer to keep it in Word. I just have a preference for Excel and just kind of keeping everything in one place. But think about that as an activity and how you're going to organize your goals and your objectives, and as a part of your evaluation plan. All right, so the next step that we're going to be looking at ties specifically to measurement. And I'm sure many of you hear about process, outputs, outcomes. In fact, I've already been talking a little bit using that language today. During our first webinar, we walked through the process for performance management and what that process looks like. But our next step is really going to be the measurement part. So the process of collecting measurement data so that you can actually use that data to determine whether you have met your objectives or not. And so that is going to be our next step. Performance measurement, if you haven't heard, is collecting measurement data for inputs, processes, outputs, and outcomes. And I have samples that we're going to be walking through from a measurement standpoint that hits all of those different areas, so inputs, processes, outputs, and outcomes, really focusing on processes, outputs, and outcomes. And then once you do your measurement, the performance management piece is using those performance measures to manage, improve, lead, or develop your program. So you then can use this data, as I said, to determine whether you've met your objectives, what worked, what didn't work, so that you can tweak your program. You may decide to make significant program changes based on what you've learned through performance measurement. Input measures. I'm assuming that most of you have heard about inputs, process, outputs, outcomes. But just as a reminder, these are 4 different types of measurement. The input measures are the resources that are used by the program. So this can be the money, the people, the tools that have gone into it, so the number of full-time equivalents that have been used, partner contributions, outside tools, resources, data, etc. Those are all the inputs that go into your program and its operations. In terms of process, so one of the areas that we talked about from an objective standpoint was what is your program's process? How are things working? Are they working in the way that they were intended? This is the operational functions of your program. Some of you are looking at process improvements. So the time it takes to process an invoice, the time it takes to get your SHIP funding out the door to grantees, the time it takes to develop a survey instrument, or the resources that it takes to do that, to complete a course or administer a grant. It's all about kind of the operational functioning of your program. Then there's the outputs piece. These are the measures for the products or the services that are delivered. They're the activities that SHIP has control over, such as the number of workshops conducted, the number of projects completed, the number of staff that were trained, the number of networks that were involved. This is all about kind of the counting of the activities that were done, or the products that were delivered to your grantees. Then there's the outcome measures piece. And the outcome measures piece, they are the consequence or the result of what happened. They can be attributed to one or more intervention or activity. I think sometimes people think that, you know, an outcome is specific to one activity. It's not. It can be a series of activities. Outcome measures typically reflect change. So your changes in Hcaps scores, your changes in terms of quality of care if you're looking at something else. If you're trying to advance your hospitals towards alternative payment models, the advances that they make there. If you're implementing community paramedicine, advances that are made there, ICD-10 improvements. So for example, other examples, rural hospitals that adopt lean or establish a patient experience team. Consequences, just results, things that are changing due to the work that is being performed. Does anybody have questions about the measures that we're going to be referring to today? Then I should ask, is this concept of measurement, inputs, process, output, outcomes, is this new to anybody who's in our collaborative? Okay, great. All right, so when we talk, we'll talk a little bit more about this, because I think if, you know, for people that have a lot of experience with just measurement in general and being able to differentiate between process, outputs, and outcomes in particular, it really makes that measurement piece seem a lot easier. So I'll circle back with you and just make sure that, you know, it's clear, and we'll talk a little bit more about it just in case. And anybody else, if you want to talk more about this, just make sure that we talk about it more during our one-on-ones as well. All right, so a couple of just kind of questions to consider as we move into this measurement piece and start creating measures and connecting them back to our objectives, is really to you know, think about, are you trying to measure the process, or are you trying to look at outcomes? And we're really, one of the things that we're pushing towards is that outcomes piece. Oftentimes when you're building a program, you start more on the process side because you're trying to build it and make sure that it's operating well, your stakeholders are engaged, the tools, the resources, things that you're doing are functioning properly. And you may want to even be looking at who is involved, so the outputs piece, because if you know who's involved, you also know who's not involved. And so you can always circle back and target the folks who haven't been involved, just if nothing else to check in to make sure that they understand, that they don't have any questions, etc. But as your program advances forward, then you're moving more towards the outcome side, and the outcomes piece is the part that you know, most grant funders, etc., are most interested in learning about, is, you know, what's happened. The other thing is not just even grant funders, but other SHIP hospitals. So if you've been able to make if you've had a lot of success doing X, Y, and Z activities, that's great information that can be shared across your SHIP hospitals so that they can use that information to make those improvements as well. Or if you've been, for example, hosting an ICD-10 class that's been really successful and your SHIP hospitals are really satisfied with it and they've been able to improve coding, etc., other hospitals that haven't been participating would be real interested in knowing that so that they can take advantage of that course as well. So just some examples of, you know, moving from process to outcomes and the value of both. The other thing that we often hear about and is to consider is if you're trying to tell kind of the whole story about your program, or if you're trying to basically tell about your story, tell the story of your program as you're developing it and moving it along. All of our programs really kind of fall into that formative side of trying to tell the story as it goes along, because if you're collecting evaluation data as you're building and developing your program, you have a lot more data that you can use in order to tell the story at the end of the program, what happened, what was accomplished, what outcomes were achieved, etc. So it's for the purposes of the SHIP program, we're really focusing on that formative side and having objectives that kind of move with the program and putting measures in place that move along with your objectives. So, and that's really how performance management works, is building your evaluation activities right into operations so that as you do your work, you're also measuring your work. I'm not going to spend much time on logic models, but I did want to put a logic model up in front of you. I think some of you may be using logic models. If this is something that you want to talk about again when we meet one-on-one, if you think a logic model might be helpful to organize your program a little bit, this is something that we can visit. It's something that logic models come up a lot. They're used a lot in planning for evaluations as a whole, but they can really help you guide, they can help guide your program in terms of thinking about the activities and then what you're trying to accomplish. So the process on the front end and the planned work that you have, and then your intended results and outcomes, really focusing on short, intermediate, and long-term outcomes. So I just threw this in here as kind of a reminder because I know some of you have that in place. But again, we're not going to spend a lot of time on this unless you want to talk about it in a one-on-one to try and get something started for your program. And I should note that the toolkit does have discussion about logic models in there, and the center has a number of logic model examples and resources on their website as well if you're looking for more information related to that. All right, so now we're going to move, we've got our goals, we've got our objectives, and now we're going to move into measures. And the goals and objectives that I have in front of you were specific to ACO investment. So for any of you that are working on ACO investment and are looking to develop goals, objectives, and measures specific to those, or to that, this group of, this sample is in the toolkit. But we'll walk through this one quickly, and then similar to the sample objectives that I had, I also have sample measures that you can pull up from the file share. So let's just start here. You'll see that there's the program area, which is the ACO investment, and then goal 1, which is support the development of our basic tenets of ACOs. And then I have three objectives that are built into it, a series of activities to accomplish those objectives. And then in this example, I've laid out the measures based on outputs, process, outcomes, and impact measures so that you can see the different types of measures that would relate back to any one of these objectives. And something to note is sometimes you'll have a measure that can apply to a couple of objectives. It really just depends on how you've crafted your objectives. So for example, objective 1 is all participating rural hospitals have software purchased and operational by January 2021. So if we look down the list of measures, we're going to be looking for the software purchase and operational by 2021. So we have, if we look down to outcome measures, I have a couple of outcome measures there. First is the number of SHIP hospitals fully implementing software and hardware. And then the next one is the number of SHIP hospitals operationalizing the use of the software and hardware. So for that particular objective, we're going to be looking at outcome measures. If we go to objective 2, all participating rural hospitals have fully operationalized the use of software by 2021. Again, the number of SHIP hospitals operationalizing the use of software and hardware. And then if we go to all rural hospitals in the state are aware of and considering opportunities related to ACO investment, we will be looking at the impact measure, which is number of participating SHIP hospitals that continue to pursue ACO participation and preparedness. So you're going to have various measures that are going to apply to your different objectives, and they could fit into any one of these categories: output measures, process measures, outcomes, and impact measures. Now, if everybody could go over to the sample measures, will you pull up the sample measures document that applies to what we were talking about earlier related to program administration? And just give me a heads up if you've gone over to the sample measures Terrific. Great. Okay. So if we look at the sample measures, again, to program administration, what I have at the top, again, I've used the same examples from before since many of you are looking at program administration and Hcaps, and I've used the same examples again, carrying the objectives and the measures for those objectives here into this document. So we start with conduct effective SHIP program administration. If you look at objective 1, so again, we're thinking about the questions, et cetera, that we want to have answered. In objective 1, one of them we came up with was in year 1, 100% of SHIP grantees receive funding within 21 days after State Office of Rural Health funding receipt. So your measure is the number of days from State Office of Rural Health to SHIP grant funding receipt. And as you can see, the measure ties directly back to the objective. And that's why I said the objective is really important. What you're measuring is the number of days from State Office of Rural Health to SHIP grantee. It should actually say, I'm sorry, it should say grantee funding receipt. And because when we create the tool to actually track these data, you'll be looking at when did the funding actually go out. And so this is the measure that you're going to be able to track to determine, did everybody get it within 21 days, if that's what you're aiming at. Another example I have on here is 85% of SHIP eligible hospitals seek and obtain funding in year 1. So it could be that the percent of SHIP eligible grantees that request SHIP funding in year 1, or it could be the percent of SHIP eligible grantees that obtain SHIP funding in year 1. Depending on your program, you may want to have one or both. It really depends on what questions you've been trying to ask as a part of, why is that an objective? Is it because you have a number of hospitals that aren't applying for funding, or is it because they apply for funding and they're not getting funding because they don't follow up and they don't meet the SHIP grant funding requirements? So knowing what you're going after in terms of that measurement is going to be important, but the measure needs to tie directly back to what you're trying to answer for that objective. If we go to the next objective, 85% of SHIP grantees are satisfied or very satisfied with the grants administration process in year one. And then your measurement would be SHIP grantee satisfaction with the grants administration process in year one. So you obviously we're as a part of this whole evaluation process, there would have to be a way to measure that, but your actual measure is going to be satisfaction. If we look at the next objective, all SHIP grantees indicated the funding options made available met whatever their needs were during year one. Your measure might be the number or percent of hospitals indicating funding option X. It may mean that you have it listed as a vendor. It could mean that it could be some program specific. Whatever that is that you are trying to meet, that it met their needs during year one. And if you've got multiple vendors, for example, that you're using, you may want to list those out and have separate measures for each one of those vendors so you can confirm that, that there wasn't a difference across vendors or that there wasn't a difference across programs. The more specific you can be, the better you're going to be from a measurement standpoint in terms of being able to figure out was it working or wasn't it working. In terms of creating that online application tool, which some of you are doing, the satisfaction with use, response rates. So a sample objective was in year one, 75% of SHIP grantees use the online SHIP application tool after initial and reminder emails sent. You may decide to have percent of SHIP grantees using the online application after initial email sent, and then percent of SHIP grantees using the online application after a reminder email was sent. This may help you to determine whether you need to do reminder emails. Is there something in terms of timing that would be helpful here? Really thinking about what are you going after in terms of the administration and getting that application tool out there and getting it used. Another example, in year one, 100% of SHIP grantees report project baseline data in the SHIP application tool. A measurement would be percent of SHIP applications that include project baseline data in the SHIP application tool. We can keep scrolling down here. If you want to keep scrolling down even further, again, there's lots of examples for you to use, but I want you to go to the last one so that I can show you something kind of a little bit different, which is the objective where it says 7 SHIP requested vendor lists are created and distributed to all SHIP hospitals by February 2020. If you want to scroll down to that one. A measure for that one would be number of vendor lists created and distributed to all SHIP hospitals